Hi, I wanted to cover the impacts of anxiety on college students between men and women. A brief overview of my presentation is that my introduction and research questions will be on slide 3 and 4, my methodology on slide 5, my findings on slide 6 to 13, my discussion and conclusion on slide 14. Occasional anxiety is a normal part of life. Many people worry about things such as health, money, or family problems, but anxiety disorders involve more than temporary fear or worry. For people with an anxiety disorder, the anxiety does not go away and can get worse over time. The symptoms can interfere with daily activities such as job performance, schoolwork, and relationships. Anxiety is the most common mental health disorder in the United States, affecting 40 million American adults each year, as well as the most common disorder amongst college students, which can have a substantial negative influence on their social, academic, and personal lives. Although anxiety affects both men and women, studies have indicated that women are twice more likely to suffer from anxiety disorders, and that gender differences affect how anxiety presents and is dealt with during college. The purpose of my study was to examine the gender differences in college students' feelings of anxiety and stress over their 4 year academics, and to explore the difference and how it affects women and men in terms of prevalence, academic performance, coping mechanisms, and self seeking behaviors. This led me to my research question of how does anxiety impact college students with women compared to men? For my methodology, I conducted a systematic search across multiple academic databases such as Google Scholar to find my sources. Using relevant keywords such as anxiety, women's health, students, mental health, and college were used to narrow the search. Studies conducted within the past 60 years were used, and these studies were analyzed and compared and contrasted on the various topics that would be presented in this case study. My findings is that the impact of anxiety on college students is significant, and while men and women both suffer from anxiety, gender coping mechanisms, self-seeking behaviors, societal expectations make their experiences and results different. Due to social and academic pressures, women are more likely to report experiencing anxiety, which results in social isolation and worse academic performance. Additionally, they are more likely to use adaptive coping mechanisms and seek assistance, which will lessen the effects of anxiety. Conversely, men tend to underreport anxiety and use unhealthy coping mechanisms, which result in untreated symptoms that can have a detrimental effect on their social and academic lives. The following studies from my research reinforce the findings, and my first topic will be the prevalence of anxiety amongst college students. According to recent research by Theater, anxiety is a significant issue amongst college students, with women experiencing a disproportionately high prevalence. Nearly 40% of college students reported experiencing overwhelming anxiety in the previous year, with women more likely than men to report severe symptoms. According to a comprehensive survey conducted by Garlow, women are more likely than men to suffer from generalized anxiety, as well as specific types of anxiety like panic disorders and social anxiety. These results are consistent with a larger body of research by Kuhner that indicates women are more likely than men to experience anxiety disorders in their early adult years, which correspond with college. My second topic will be gender differences in the experiences of anxiety. The prevalence of manifestations of anxiety in college students are influenced by gender. Anxiety is more common in women in reaction to relationship issues, social pressure, and academic stress. Women are more likely to exhibit emotional and psychological symptoms of anxiety, including excessive worry, rumination, and physical complaints. According to a study by Steiner, contrarily, men are more or less likely to report feeling anxious and may express this feeling by acting out in ways like aggression, substance abuse, or irritability. Backing this up, Malice says social norms that push men to repress their feelings and concentrate on their independence may have an impact on this gender disparity in expression. Furthermore, the different ways that people experience anxiety are influenced by cultural norms surrounding gender roles. Women are more likely to experience anxiety related to social acceptance, body image, and academic performance because they're frequently socialized to be more emotional, expressive, and relationship focused. Men, on the other hand, are socialized to place a higher value on success and emotional control, which may cause them to feel more anxious about performance demands. However, men's mental health is stigmatized and they may also be reluctant to admit their emotional distress. My next topic would be the academic impact of anxiety on men and women. Although women seem to be more impacted by social anxiety in this area, anxiety has significant negative effects on academic performance for both men and women. Anxiety has a detrimental effect on students' capacity to focus, retain knowledge, and efficiently manage their skills, all of which are essential for academic success per a 2022 study by PeerChart. Nonetheless, academic anxiety is more common amongst female students, which can affect their performance and raise dropout rates. According to the study by Pritchard, women who are more anxious found it harder to turn in assignments on time and had lower GPAs than their male counterparts. According to the 2023 study by Hernandez, college women are especially affected by the combination of social and academic pressures. Social expectations about behavior, appearance, and social achievement frequently cause women to experience higher levels of stress. These combined stresses raise the risk that anxiety will result in academic burnout and have a detrimental impact on mental health. The study by Williams stands in contrast to the studies conducted on men, which show that academic anxiety is less likely to be reported emotional distress or academic disengagement, but is more often associated with external pressures to succeed within men. My next topic will be social and interpersonal consequences. The effects of anxiety on interpersonal relationships can also differ for men and women. According to Parker's study in 2020, women are more likely to report feeling anxious in social settings, which may hinder their capacity to interact with others and build relationships. Social isolation can result from social anxiety, which is more prevalent in women and is typically a fear of social rejection and unfavorable evaluation. This is especially true in college studies where socialization is a significant part of student life. According to research by Kierberg, the pressure to live up to social and academic expectations exacerbates women's social anxiety, creating a vicious cycle of stress and social disengagement. However, according to a study by Swartz, men are less likely to report having social anxiety. Instead, they may show signs of anxiety in less obvious ways, like being irritable or avoiding social situations. The research shows that men are more likely to use unhealthy coping mechanisms like substance abuse to deal with their anxiety. Even though these actions may conceal signs of anxiety, a study by McKee said that nevertheless they lead to strained relationships and unfavorable social outcomes. Men's anxiety may therefore go undiagnosed or unnoticed, and if unled treated, can lead to long-term mental health problems. My last topic will be coping mechanisms and self-seeking behaviors. The way that men or women deal with anxiety and seek assistance are obviously different. According to Guro, women are more likely to employ adaptive coping strategies like seeking social support, going to therapy, and practicing relaxation techniques in order to address their symptoms before they worsen. Women are more likely than men to seek professional assistance for mental health and anxiety issues, according to Lovery. Higher levels of emotional expressiveness and a growing understanding of the significance of mental health care in young adult health may contribute to the women's willingness to seek help. Men, on the other hand, typically resort to less adaptive coping mechanisms like aggression, alcoholism, and avoidance. According to a study by Malik, additionally, because mental health treatments for men is stigmatized, they're less likely to seek professional help for mental health issues, and men are more likely to minimize or disregard their anxiety, which frequently results in worsening symptoms over time. This unwillingness to ask for assistance may postpone diagnosis and treatment, which can have detrimental long term effects on the mental health and academic achievement of men. In conclusion, gender roles are important role play an important role in shaping the lives of students, sometimes leading to different experiences of anxiety. The varying ways in which both men and women experience and cope with anxiety highlight the urgency for tailored mental health interventions that consider these gender disparities and help resolve them. Encouraging open discussion on these topics can help mitigate the negative effects on students. And in the future, additional research could focus on how college students within different majors are impacted by anxiety and how students in one major differ from another. And these are my sources. Thank you.